Are you confused about COVID? Some doctors in the Family and Community Medicine Department at the U of T think you might be, so they've put together a website to answer some of the questions you may have. The website is available at ConfusedAboutCovid.ca. And to learn more about it, we're joined by Dr. Danielle Martin, academic family physician and chair of the Department of Family and Community Medicine at the University of Toronto. And she joins us in her office at Women's College Hospital in the downtown core of Ontario's capital city. Dr. Martin, great to see you again. How are you managing?
Great to see you, Steve. Thanks. I'm managing pretty well, but it's been a busy time for me, as for so many others across the healthcare system over these last many weeks. So
Absolutely.
We were happy to have a chance to play our part in trying to cut through some of the confusion out there.
Well, tell me, let's start there. Why did you think a website like this was necessary?
Well, this wave of COVID, more than any of the previous waves, this Omicron wave, is really playing out in the community. I'm sure that every single person watching today has either had a COVID infection or knows someone personally who's been infected with COVID during this last wave. And the information out there can be really confusing. And so what we're seeing in our offices as family doctors is just a lot of phone calls, messages, emails, people coming in trying to understand, should I be rapid testing or shouldn't I be rapid testing? Do I self-isolate for 5 days or 10 days? How do I self-isolate in my household? How do I know when I'm ready to come out of quarantine? How do I care for my child with COVID? All of these questions that as the infection numbers are so high in the community, we are being flooded with these questions in family medicine, which is, of course, what your family doctor is there for. But nevertheless, we felt it was important that we come forward as a discipline. And so we've partnered up with the Ontario College of Family Physicians, and we've put these resources out to answer some of those very common questions that we're seeing in our own practices. And we're pleased to say that these resources are also available on our website in French, and we have 5 more languages coming soon.
I guess before we actually show people the site, I was going to ask you whether you're surprised 2 years into this thing that people still have so many basic questions, but maybe the better question is, are you depressed about the fact that 2 years into this, people are still asking some of these most basic questions?
I have to say that in the process of writing these, we got confused more than once ourselves. Part of this is the guidance keeps changing, and that is understandable. As we learn more, as the pandemic shifts around us, the advice is different from day to day. And some of it is also relates to, we have never seen before over the course of the pandemic this many people being infected at this rate, many of whom are previously vaccinated, but some of whom might not be. And so the advice really differs depending on your circumstance. And so, I'm depressed, I suppose, Steve, in the sense that we all wish we weren't having to still be dealing with these questions and able to move on. And certainly it's not how any of us imagined we would be spending our time as family doctors. This much of our effort going into immunization and management of COVID in our own practices. But nevertheless, I think that this information is helpful, and it certainly does feel necessary.
Well, let's take a look, shall we? I'm going to ask our director, Sheldon Osmond, if he would, to go on the website, ConfusedAboutCovid.ca. There we go. And let's scroll down, because that's sort of the title page. Then we get to a bunch of boxes with a bunch of very typical questions. Let's click on the one, I'm worried about the new variant. How do I keep safe during Omicron? And again, people can scroll down, and there you've got a lot of very useful information about what you can in fact do to stay safe during Omicron. Now, let me ask you this. People are getting information from all over the place. Why should they trust this information more than what they see somewhere else?
Well, this information is brought to you by the Family Doctors of Ontario. So if you trust your own family doctor or nurse practitioner, your own primary care provider, if you would trust the advice that you would get from them, that is who has put this information together. And we've done it using the best available evidence, drawing from public health guidance and provincial and national guidance, but also interpreting it, which is what we do in our offices every day. In family medicine, we try to take what can be pretty complicated guideline type advice and distill it down to what are the critical things that you need to know in your current life circumstance. And so we're not inventing this stuff. It's not new information. It's information that has been collated, pulled together, and synthesized in a way that we believe speaks to the questions that we hear from our own patients every day.
Okay, I don't have to tell you that people are mistrustful of a lot of people that they used to consider authorities on various things. But do you feel that family docs, during the course of the last 2 years, during this pandemic, still are basically trusted by their patients?
Absolutely. I suppose it would be better to ask the patients that, but I will say in my own practice as a family doctor, that this is when we can be most useful and helpful to our patients. We spent a lot of time in the earlier phases of this pandemic relying on assessment centers to carry out swabbing and testing, and mass immunization clinics to carry out immunization. And family doctors were participating in all of that work. We were all out there participating in outreach to shelters and immunization clinics in strip malls, and doing what we could to participate. But we're now in a new phase. And in this phase, coming back to that relationship that you have with the person who is your navigator through your healthcare journey, which is your family doctor or your primary care provider, is really important. And I think that we, as we look to the post-pandemic healthcare system, rebuilding those relationships is going to be even more critical.
I am going to be so bold as to say that I bet one thing that does depress you and has depressed you during the course of the past 2 years is that many people, many of our friends, are just as happy to take medical advice from some quack on Facebook as they are from a family doctor that they've been going to for decades. In which case, what prospects do you think your website can have fighting so much mis- and disinformation that's out there?
I don't think that we're here to go toe to toe with somebody and posting stuff on Facebook from their mom's basement. Our job is to bring forward our own expertise and evidence, and to rely on the relationships that we have with people over time. I will say, Steve, honestly, that we see so many people who bring into us what it is that they're reading to ask for help interpreting it, that I think it's not a question of trying to erase all of these other sources of information, but most people will trust the healthcare provider who knows them best to help them to interpret, what does this mean for me? And whether that's an article that you read in People magazine or whether it's a post that you read online, if you're not sure whether something is for real, and that is exactly the role of your primary care provider, is to help you to sort through the mess of information out there and help you understand what's most relevant to you. Sometimes what you read on the internet might be based in fact, but we all know that sometimes it might not be.
Do you want to take us through maybe a bit of Internet 101 here and tell us what sources online, obviously you'd put your own new website in that category, what sources you consider to be trustworthy, and some sources, based on what people have brought into your office, they should just absolutely disregard and say, that is not appropriate, that is not reliable?
Well, the first thing that I always say to people who bring in internet research is, I'm glad that you're researching. We actually do want people to be informed, and we do want people to be taking charge and active participants in their own health. But Dr. Google is not always your friend, and understanding, the source of the information is critical. So if somebody posts something to a chat room or a social media source that you wonder if that is for real, the first thing to do is try to ascertain what is the source of the information. And often you can learn that by looking at the source of the website itself. So, a website that comes from a public health agency is probably to be, much more trustworthy, as opposed to a website that, is I like COVID.com or some kind of thing that someone's invented, for themselves. And one of the things that we see in websites that are propagating misinformation about whether it's COVID or anything else is that it is common to put the name of the disease into the URL itself to make it look more official. And so the other thing that is important to look at is, what is the funding source of that website? And so, you'll see the website that we've put up is clearly part of an extension of the university. It comes from the University of Toronto. That's our funding source, and the Ontario College of Family Physicians. But if the funding source isn't disclosed, or if the funding source is brought to you by the makers of a supplement that is then recommended on the site, then that should make you raise an eyebrow and wonder, am I getting objective information here? And of course, the bottom line is, if you're not sure, ask. That's why you've got a healthcare provider, is to help to guide you through that information.
Right. Okay, in our remaining moments here, let me take advantage of your being here, just to ask you a couple of questions about where things are at today. We know that there are a lot of people in hospitals across the province right now who have been vaccinated. And so I want to ask you whether you can still recommend, with as much vigor as maybe you could 6 or 12 months ago, that people get vaccinated in light of that reality.
Absolutely. And I have to tell you that the patients of mine who have ended up in hospital, who are not vaccinated, have been horrendously ill. So a hospitalization is not a hospitalization is not a hospitalization. Your chances of ending up in the ICU or dying are much, much, much higher if you are not vaccinated. And many of the people who find themselves in the hospital with COVID today, who are vaccinated, are not in hospital because they have COVID. They're in hospital for some other reason, and it happens to be discovered that they also have COVID, which is very different. And that's only because there's so much COVID-19 out there. So remembering that the vaccination does not guarantee that you will not get infected with COVID-19, but it does really significantly reduce the likelihood that you will end up life-threateningly sick with COVID-19. And that is ultimately what we care about. We care about protecting your long-term health and your life. And so I went out and got my booster as soon as it was available. I was giving vaccines in my clinic today. I recommend it with as much vigor, in fact, more, because I worry for the health of my and mental well-being of my patients, given how hard it is in our hospitals right now, Steve, how overworked our workforce is, how many nurses and physicians are sick themselves, the immense pressure that is being applied to our hospital system right now. I would not want to go into the hospital right now. I wouldn't want you or anyone else to go into the hospital right now. So we should all be doing everything we can to avoid getting sick and going to the hospital unless it is the safest place for us. And so anything that we can do to reduce our risk of hospitalization right now is good for us. And it's also, of course, good for the healthcare system.
And that's the last thing I'd like to get you to react to, because there was a fairly significant development in the healthcare system last week when the green light was given to resume some elective surgeries and diagnostic tests that have been put on hold for so long because the system had to pivot to taking care of COVID-19. What's your reaction to that development?
Oh, I hope that this is a sign that we are now beginning the long, slow journey through to a different kind of a healthcare system at the end of all of this. I mean, we now do face a significant backlog of surgeries and procedures. I know in my own practice, people who've been waiting very patiently to see a specialist, who've only been able to get a virtual appointment or been waiting for an MRI or whatever it is that has had to be rescheduled. So we have our work cut out for us. And of course, not just in healthcare, but all over every sector of the economy. This recovery is going to take a lot of time and energy. And so I hope that we're finally at least in a place where we can begin to look to that work instead of the constant putting out of fires that we have all been experiencing in the healthcare system over the last couple of years.
Amen to that. Dr. Danielle Martin, we are always grateful for your appearances on our program. We'll remind people, ConfusedAboutCovid.ca is your latest contribution to the fight against COVID-19. Thanks for taking the time to spend with us tonight here on TVO.
Thanks, Steve.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.